Hello, everybody. Welcome back to Let's Talk About Sleep, where we are going to talk about sleep. The link to this is in the description box down below, the Amazon link. As I always say, these videos are for educational purposes only, so you definitely need to talk to your provider about anything that we talk about here if it's something that's on your mind. Okay? If you like this video, please click like. Please subscribe to the channel. When we get to 1,000, one lucky viewer is going to get a signed copy of Let's Talk About Sleep. And with that being said, let's get into the video for today. We're going to be talking about reflux as it relates to sleep. So, reflux, otherwise known as gastroesophageal reflux disease or GERD, aka heartburn. Okay. Very, very common problem. I have it myself. Everybody gets it a little bit differently. So for me, when I have heartburn, I get it right here. Some people get it in the chest. Some people have what's called silent reflux, which is they just don't really experience it, but they may wake up throughout the night. Some people cough, all right? But reflux is a very, very common problem. And when we talk about sleep and sleep disorders, it's very, very commonly seen in obstructive sleep apnea. Okay, and why is that? Well, how do we breathe? Let's take a real big step back. So how do we breathe at all, right? What happens is the way normally our inspiration works is our chest expands, our chest cavity expands. We generate a whole bunch of negative pressure here, and then we suck air in from the environment. That's how a normal breath occurs, okay? When we talk about obstructive sleep apnea, as we have many times on this channel, you have a blockage here, okay, back where the tongue sits, and what happens is the chest has to work really hard to generate all this huge negative pressure to try to overcome that blockage. What can happen sometimes is there's so much negative pressure generated, it actually can suck acid up from the abdominal compartment from below, i.e. lead to reflux. Okay, especially at nighttime, especially when the person is flat, okay, on their back. We very commonly see that there's an overlap between obstructive sleep apnea and reflux, and if you treat the sleep apnea, a lot of times the reflux, it's not going to go away, but it may get better. Okay, so just something to be aware of. Another thing that's important to know is that if people have this frequent awakening throughout the night, coughing, let's say, that may be part of this silent reflux, where that's the only symptom they have, is this kind of the irritation, okay, in this region leads to coughing and waking up throughout the night. Okay, so if somebody has reflux and they're waking up throughout the night, it might be an idea to at least consider, or at least talking to your provider about getting a sleep test, okay, especially if they're snoring, but even if not. All right, so something to consider. What's interesting is one of the treatments for nighttime reflux is to have people sleep on an incline. Right, you'll hear GI docs say put like maybe bricks or so on the foot of the head of the bed rather, so that the bed is kind of on an angle like this. Interestingly, is why I say it's interesting is because we do the same thing for sleep apnea, right? The ideal position to sleep when somebody has sleep apnea is on their side, right, in the fetal position. But if somebody has to sleep on their back, one of the things I always tell them is I want you to be on an incline, okay? The thing to avoid, though, is flat on your back, right, in both cases. And I think part of that is because of this double problem, all right? So if there is nighttime reflux especially, or daytime reflux even, and there's not really a good explanation as to why, or there is a good explanation as to why, and there may be disrupted sleep, definitely have a low threshold to get yourself tested, okay? Because there, like I said, there's definitely an overlap there, okay? So that's the video for today. Kind of a short one, but just something to keep in mind as we go forward on our sleep journey together. If you have any questions or comments, please drop them in the comment section down below. The link to the book is in the description box. And until next time, sleep well.